Welcome back to Zero Diabetes Zone, your go-to channel for all things diabetes related. Today, we're diving into a crucial but often overlooked topic, the impact of hormones on blood sugar levels. If you've ever wondered why your blood sugar can be so unpredictable, this video is for you. Hormones are chemical messengers that play a vital role in regulating many bodily functions, including blood sugar levels. The most well-known hormone in this context is insulin, produced by the pancreas. But did you know there are other hormones that can also influence your blood sugar? Let's explore. First up is insulin. When you eat, your body breaks down carbohydrates into glucose, which enters your bloodstream. Insulin helps your cells absorb this glucose to be used as energy, but in people with diabetes, either the body doesn't produce enough insulin, or the cells become resistant to it, leading to elevated blood sugar levels. Now, let's talk about counter-regulatory hormones glucagon, cortisol, and adrenaline. These hormones work against insulin to raise your blood sugar, especially during stress, illness, or fasting. For instance, glucagon triggers the liver to release stored glucose into the bloodstream when your blood sugar is low. Cortisol and adrenaline, often called stress hormones, can also raise blood sugar levels during stressful situations. Stress is a significant factor that can cause your blood sugar to spike. When you're stressed, your body releases cortisol and adrenaline, preparing you for a fight or flight response. This hormonal surge can lead to higher blood sugar levels, making it more challenging to manage diabetes for women. Hormonal changes during menstruation, pregnancy, and menopause can also impact blood sugar levels. For example, the hormonal shifts during menstruation can cause blood sugar levels to fluctuate, and pregnancy often comes with increased insulin resistance. Understanding these changes is essential for better diabetes management. So, how can you manage the impact of hormones on your blood sugar levels? Here are some tips. Number 1. Monitor your blood sugar. Keep a close eye on your levels, especially during periods of stress or hormonal changes. Number 2. Manage stress. Incorporate stress relief techniques like meditation, deep breathing, or light exercise. Number 3. Consult your doctor. If you notice significant fluctuations, talk to your healthcare provider. They might adjust your medication or recommend lifestyle changes. Final reflections: hormones play a powerful role in managing diabetes, and understanding their impact can help you better control your blood sugar levels. If you found this video helpful, don't forget to like, share, and subscribe to Zero Diabetes Zone for more diabetes-friendly tips and advice. And as always, stay healthy, stay informed.